Good afternoon, Jan Recker.
Hey
How are you?
Nick, I'm good, thank you. How are you?
Well, good, and I'm very excited. I continue to be excited by our special issue on artificial intelligence. And today we have Lynn Wu from the world famous Wharton School joining us. And Lynn, you're an author of a really phenomenal paper about drug discovery in this special issue. So we're hoping to talk to you about that a little bit today. So welcome to the podcast. Yeah.
Thank you.
Now, this is a very cool paper. You're studying drug discovery, right? And it's this issue that this huge space of possibilities to come up with new drugs. But since humans are limited, we only focus on like little clusters of areas. So we're using artificial intelligence to kind of try and explore this. And your paper is awesome in that, you explore that exactly, like how does it work, right? How do we innovate? How do these companies innovate, and what capabilities do they have in place to get the good conclusions, right?
And you know what I like best about this paper? Like my absolute favorite part of that paper is your appendix. And I don't think I've ever said that about a different paper before. But
No.
this appendix where you explain chemical similarities and drug novelty and sort of get it to us people that have no idea about the drug process. I just always like, well, that is so cool that someone actually, it tells me a little bit about the complexity of what we're dealing with here, right? So that we're not broad brushing it. So you deep dive a little bit into chemical aspects of it. And I love that, but it's an appendix. Did you ever envisage this to be appendix, or was it a thing where you thought, oh my goodness, I really hope that would go into the main body of the paper?
We did, and then we decided not to because of page limitations. I mean, this is MISQ publication, and we want to get our main construct, the AI capabilities in, and we want to make sure our main findings and managerial implications are in. So in the beginning, yes, they were in the appendix. They were in the main part of the paper because we thought it was important to let you guys know how to measure it. And this is a unique set of data that I think that could help broadening the IS field to learn more about how to use computation and data analytics and in chemistry and drug discovery in a broader sense. So we were very excited about that first. And then subsequent iteration of paper, we're like, okay, this is getting too long. So
but exactly, that's exactly my point. I mean, you're showing how sort of IS knowledge and sort of the things that we deal with, computational analytics and NI, how that informs things outside the business school, in chemistry of all things. So like, I don't know for sure, but that might be the first IS meets chemistry paper that I've ever seen.
Well, but what I think is interesting is, correct me if I'm wrong, Lynn, this seems to be kind of the similarity score of yours is really kind of a Euclidean distance score, right? Between two. And what's interesting is this is a paper about innovation. And we were talking, Recker, in a previous one, I think we talked about Kyriakawa and Nickerson's paper on innovation in 3D printing models. And they were coming up with Euclidean distance score. I really wonder if this distance is becoming the way to computationally measure innovativeness, right? I don't know. What do you think, Lynn? Did you think of other ideas on how to measure innovativeness, or?
I think it's definitely a great way of doing it. So let me give you a caveat. We did not invent that method. It was invented by the pharmaceutical industry to measure their own drug innovativeness, and there are many ways to do that. Yeah. So this is chemists has figured out. Okay, to do the string. ASCII string for each 3D compound and translate into a piece of code that machine can understand, and then compare that code to see how similar the chemical properties are. So this is not our invention. This is the chemists, the biologists, the experts who know what they're doing invented that method. And
same thing with genetics and stuff like that, right? It's similar.
Exactly.
But you don't have any chemist on the paper, so to speak, right? So, how come you know this stuff? Did you read up a whole bunch of chemistry journals, like the equivalent of MI's Quarterly in chemistry, whatever that might be?
We got exposed to a MBER paper actually that first talked about this chemical structure. And then we delve deeper into it and then say, oh, there's actually a way to compute it. And then the algorithm is very clear. You don't need to know chemistry to do this. the codes, the ASCII codes are already, like each compound, there's somebody already translated the ASCII code.
Mhm.
See, economists can do anything. Just give it, right?
I wouldn't say that, but and then you can compare. We just used our data analytics skills to AI skills to compute that innovative difference, right? So the difference between ours and maybe earlier work is that we did the most advanced version possible, the most updated version possible by the chemists to compare this.
The other variable I kind of like that you came up with, of course, is your capability, your AI innovation capability. And I'm sure you'll be, and even from the beginning, I kind of liked it. And I was wondering if and I know you cite some papers that justify this. So there's the patent part, but then there's the job openings, and you operationalized it through job openings in AI jobs, right? And I can understand how if you have openings, that kind of indicates that you might have these capabilities, but couldn't it also just indicate that you want to build these capabilities and you might not have them, or you know what I'm saying?
Yeah, absolutely. So that's definitely a legitimate concern. So what we did is we used some lags, like, if you post a job posting a year or two ago, hopefully you completed some percentage or maybe all of it, probably not all of it, but some percentage of it. So we kind of use lag to do that. And then we, as a robustness check, we did various lags and didn't really change our result. So we do believe is some kind of you don't create job posting on AI out of blue. You must have something already there to build upon it. So we think the fact you have some job posting means you probably have some existing AI capabilities out there already, so you can actually use that person. Like if you hire AI person, you have nothing, no infrastructure, right? That person can't do anything, right? So we're kind of use job posting that way. And secondly, I think secondly to get the question of using job posting is that it's just readily available. Like this is data you can easily acquire, and many people here, you can just go to Glassdoor and download it. It's also for a point of view is it's not so proprietary data. You can actually
you can go to Glassdoor and just download this stuff.
You can scrape it. You can web scrape it.
You have to scrape it.
But I like it too. I mean, I like that capability from the start, simply because if in the tradition of measurement development work, it's a new way of thinking about how to measure these types of capability, and it's just it's unique, it's new, and on some level I always think it's way better than traditional report measure, for example, or if you look up, I don't know, some company reports and try to aggregate some sort of statements from there to build this way. The other really nice thing about it is that you can use this way of measuring AI innovation capability to distinguish it from IT innovation capability, right? Which is another thing that you do in this paper. And in that process for the special issue, we pushed all the author teams very hard on separating AI from IT and explaining what is different, and explaining where it's the same and where it's not the same as traditional IT. And of course, with these types of measures, you can do this very nicely, right? You can empirically demonstrate where and how some differences might manifest, right?
Absolutely. And I had to thank the editorial team for really pushing us on this, because at first we just had a measure and we know it's an AI measure, we're confident about it, but we didn't really think that deeply of how that mapped to the capability literature, the IT capability literature. So that get us really think about theoretically about our construct. Like, what does it exactly match into? Is it human resources? Is it about infrastructure? Is it about some intangible assets? So that made us, really we got really deep into the IT capability literature to see how people measure it, and we see the pros and cons of measurement, and we were really hard to map it into the existing construct of capability, then create a AI innovation capability that derive from that.
So I want to get a little bit into the process, even though, Recker, I have a theory about Lynn's process that I'm going to give you after.
All right,
but before we get into the process, I did have one observation that before, you and I actually, Lynn, talked about a little while ago. You motivate your paper in that, there's this tremendous problem space for the potential to generate new drugs. Humans can't possibly navigate that entire problem space, So the nice thing about AI is it can do things humans cannot. humans, if we're doing drug discovery, we tend to cluster in the areas that we've successfully done so in the past. AI can do all sorts of things. Well, one of your essential findings is, well, AI is really good when we've already done some stuff in the past, right? And it tends to cluster like you. So one kind of cynical view of this could be, yeah, well, AI is pretty much doing what humans did.
Yeah, it's not a black and white, human did or machine did. It's a spectrum of things, right? There are things human are really good at, and there are things machine are really good at, and that's a big spectrum. And here what we're saying is not that necessarily that humans good at it. I think human could potentially do it if you gave them infinite amount of time and resources.
Yeah.
Right. But you can't do that. You don't have infinite time and resources. And here is what machine does: expand your ability to search very broadly across much bigger place to find connection recombinations that you just couldn't do before, right? Yeah. You can do combination maybe 10 things in your surroundings, but if you're talking about 10 million, that's hard, that's difficult to do, right?
So isn't that defining to me? Always think like at the moment AI yields a computational advantage in drug discovery over humans. It literally can just search a larger space, and it does so because it's still the learning that the AI uses is still sort of modeled on human learning, right? Whether it be supervised or unsupervised, it's still sort of emulating what we do, and therefore I don't think it's very surprising that you find that it sort of does the same thing, just larger in scope and volume and so forth. But if you think about it, wouldn't that mean that if you build a new generation of AI that works off very different approaches to learning and doesn't try to emulate what we would do just with a computational advantage, but really would try a very different strategy, then it would not be a computational advantage only, then it would be a qualitative difference. It would yield very, very different results. So I don't think that I think the results make perfect sense. But given how AI is constructed at the moment, and if in the future, if it's constructed differently, then we might see very different results. Would you agree?
I think so. I agree and disagree at the same time.
Good.
Give you the cop-out answer.
An academic's answer.
Yeah, I agree because I think you're right. The currently learning algorithm is still very, it's similar to human, but it's not human. It's not close to human. We're not anywhere near artificial general intelligence in a sense. We can emulate human brains, right? When we are at that stage, I think we can do a lot more, like just exponential more than we could. But now we're still emulating, I would say, some very stupidity of our learning, but we're doing really, really well.
Yeah.
Like you can know right. Yeah, something we can do, but we can do it so much faster and better than you do. But that's a very small part of what we do. Yeah. Right. So in that sense, I think, it magnifies our ability in only that little chunk here. Yeah. But then there's still so many other things, our creativity, our intuition, our mental map of what's of the world. All of that's very difficult to model. And current technology, AI, is just not there yet. Maybe in the future. But at least in my, understanding, I think we're not talking about, 10, 20 years. We're talking about many, many decades away from that.
I'll tell you what, this paper is a beautiful paper. The empirics are pristine. They're beautiful. The thinking is wonderful. The findings this will be a very impactful paper. It's the first, AI and tangible outcomes on drug discovery paper in organizational research. So congratulations on a great paper. Now, Recker, I'm going to tell you what happened when Lynn wrote this paper.
Oh, you tell me what Lynn did?
Yeah. Okay. Because this is what happens. You and I, most people don't have this, but since she's at the Wharton School, this is what happens. She has a huge kind of mahogany office somewhere in some high tower somewhere in Philadelphia. And what she does is she just sits there smoking her pipe.
I have a view of AC ventilator, so
Yeah, and then she lets a couple of her assistants know that, hey, I think I'd like to do research on drug discovery and AI. So they go out and collect all the data for her. And then she has a team of people who then analyze all the data for her. And then they write it up, and then she approves it. And is that kind of how the process went, Lynn?
I think you're talking about HBS, not us.
That's not true.
You know what? Like, you know what? I'm listening to this and not being American and not in that American system. Apparently, there's all sorts of competition between the different schools. Like, I have no idea what you're trying to do here. I don't know where this is heading at all.
This is one of the great business schools, and it's funded so well that I'm just, their professors are like royalty. No,
well, that's good for Lynn, I guess.
Yeah.
No, actually, it's a two-man team. I'm telling you, it's two-man team. They were just me and Bowen. That's it.
You guys did everything?
We did everything ourselves.
So I have a serious question about this, Lynn. So we asked all the author teams where their ideas came from, and it was kind of surprising. We had author teams that saw the call for papers for the special issue and then decided to do stuff, which we found was very odd. And then we had people that were working on sort of managing AI topics for a while, and then they saw the call for papers as an opportunity to sort of publish the work they've been doing anyway. Where do you sit on this? When and where? How did you come to the idea on AI on drugs?
So we've been at it for a while. I would say around 2019, 2018-ish. Mm-hmm. That's when we actually 2018 in middle 2018 when we first started. It really came from the fact that we see lots of AI driven innovation in health, like, oh, Anamize did this as discovery, so this many drugs in a day. IBM Watson discovered this many new compound a day, and it was just like, wow, but Benefit AI did all these markers that could solve all these amazing curable diseases. I was like, oh, that's great. And then IBM Watson was like, I don't know, in like 2010, 2011. Yeah. And then just nothing happened. Like, what happened?
Exactly. Yeah.
Right?
IBM Watson is my favorite example of a technology that fizzled out.
Oh, it didn't fizzle yet. It's still there. They're just
It's just like, well, it's okay that you discovered this compound, but what happened to these compounds? Like, are they somewhere made into a drug that somebody was using? So that's kind of motivated our ideas. Like, what happened to these drugs? And so then we delved deeper and deeper into it. Like, oh my God, actually drugs got more expensive, take longer to do. And then there's the other side is like, oh wow, the AI is doing all these wonderful things, it's gonna revolutionize pharma. And pharma is still, spending billions and nothing has changed. So, and if anything, it got worse. And so that's kind of prompted us to look into this in greater details, like what's really going on here.
So Bowen's your student, and you were already working on this before the special issue, right?
Yes, we worked on at least I think a year or 18 months before the special issue.
Yeah. So,
but kudos to the person who admitted to you that they look at the call.
Like we were baffled. I mean, there was really a team that got together because of the special issue call for paper and then sat down, and they did a simulation study, because rightfully you can't do empirical work within a few months, right? But you can pull off a simulation. They had a large author team. I think they had 8 authors, so lots of work, well coordinated, and they pulled it off. I still think it's amazing, but that's why I asked. I have a different question, but it's not about the process. So Nick, you wanted to talk about the process.
So no, just to go back to it's you with Bowen. It's 2 people working. Was this part of his dissertation, or is this?
Yes, it is.
Okay.
Yeah.
Well, good for him.
Is he graduating, or where is he?
He's at UConn right now. He's a professor at UConn.
So he left. He's assistant professor. Okay, so this was when he was, but his work was there. It was during his PhD, and it was literally the 2 of you just working.
Yeah, it was just 2 of us. Yeah.
Scraping all the data. Was there any additional data collection you did because of the process, or no? You had all the data pretty much.
No, we collect the data as we went.
So you submitted in November. Now, if you remember, we accepted your paper just over a year from when you originally submitted, right? Over the course of that year, was it mostly analysis? Were you collecting additional data? How did you coordinate between the 2 of you to meet
we
that
definitely we kind of collected the data, because as we got into more like what's the mechanism, was like we realized, okay, we need additional drug information. For one of them, like, well, does this drug class exist before, or something we didn't have before? And also, do we know the drug mechanism of how it works in the human body? Like there's either a way to find that. So luckily, there were databases on this, so we have to collect those data on these new drug properties to reinforce or to further help our theorization of the paper.
So Lynn, as Nick said, we wanted the process to be fast. We designed it to be fast, and sort of kind of show that you can, do these papers and get them published in a year, thereabouts. Obviously, what we didn't foresee was there was a pandemic hitting, in the same time frame, and every now and then we felt pretty bad for us pushing ourselves, pushing editors, reviewers, and of course the authors. So how was that process for you, given that it happened in the middle of a pandemic that interrupted many people's lives, and we were still, doing very quick turnarounds on the reviews, but also on the author cycle. So we didn't
you
give
went
you
through
half a year.
4 or 5
Exactly,
rounds
right? In a little bit over a year. How was that experience?
I think it's a great experience. I've never, honestly, I know the pandemic has really put a wrench on everyone, including my life. I have 2 young children, so they weren't in school, and I had to take care of them. And Bowen had a baby as well.
Oh, really?
Wow.
Yeah. So, but I feel like we want to do this. This is our top priority at the time. So we did what we can to make sure it happened.
And your 2-year-old was or under 1 years old when you submitted. So that was a baby that you were dealing with.
Yeah, I was a baby. Yeah, his baby and my baby were 3 months apart. So
Wow.
or 5 months apart. Yeah, something like that. Yeah.
Some amazing work here. Yeah, absolutely.
So we just, I think with all things in life is priority, right? So we had one priority in our, at least I did. I had one priority to get this thing done. So,
Did you have like
all
weekly
family come
meetings?
first.
Weekly meetings?
No, we don't do that. We do as we meet as we need to meet. We don't need to have this weekly meeting thing, because I think it's kind of counter.
You give each other milestones or something, and then they come back with when the milestone is accomplished, or how do you do this? So
we have a meeting. We have a strategy meeting, how things are done, and then we divide and conquer, and then once, often the sequential. So I need to wait for him to do my part, so he makes sure I get it done, and I need to do my part before he finishes his next part. So
wow, that's amazing.
Yeah. We can parallelize things. Yeah.
You wouldn't know this, but we asked the same question to all authors teams, and we get vastly different project management approaches. One team had a Gantt chart, so structured with milestones for everyone. The other one really implemented agile Scrum things to push them along. And here you come, you sort of like, hey, we sort of, we did this, we came together and everyone did the thing. So I find it amazing. We have 6-7 different papers and 7 different strategies for collaborating between the author teams on the papers. No one size fits all, that's for sure.
Yeah, I mean, there's only 2 of us, so I feel like we don't need agile guns thing. We just need a text messages too.
Yeah, fair enough.
Now, Lynn, it sounds like you did it serially, where he did his part, then you did your part. I always like working serially. I hate it when my project teams break things up into parallel. I'll do this, you do that. And it's because I think that, projects should be integrated and everyone should know what everybody's doing. And I don't know, what do you think about that? Because you were about to mention something about parallel. Wrecker can be rude like that. He interrupts people.
We parallel some things, but when we're seriously thinking about, responding to the review team about certain things, we need to know the results before we can step up to figure out next step. So that part is definitely serial. But certain things, I can do one part and he can do the other part. That some parts can be parallel, but the really serious things have to be serialized.
So I've been digressing here a little bit, but I'm sort of sitting with Nick here. So, for example, one thing I hate in author teams is when people say, "Let's use Google Doc so we can all work on the same document at the same time or anytime." Gee, I hate that. Like, I really like it more in that classical rounds base. So I have the version, I have the log, and when I'm done, I'm passing it on to the next person. So when everyone is, writing while I'm writing in the document, gives me shivers.
I think I think I've done both, but I think for academic papers, it's very clear. Most cases, you got to do the serial way because you need to understand the whole picture. Like, you might be writing the method part and the result part. Some like that does not conform with what's up there. So, and even other teams, you think you understand each other's mind, but we don't. So there are many things we don't see, and also you might be writing and changing your mind. So actually, it's not that way. So we definitely did a serial writing. Like, I have a lock of the document. He has a lock of the document later, et cetera, et cetera.
So Nick gave a lot of praise about this paper. So do I. I mean, like I remember it developing, enormously over the review process, and in later stages, I really love this paper. I think it's really strong. And I mentioned this in the beginning that I think this is, I think, probably the only paper in that entire lot that I think has incredible potential, not only to be impactful in our field, and I think in our field, it would have some impact in terms of showing people how they can measure AI capabilities in a different way. So I think that's cool. It obviously has very pristine empirics, but I think, this is a paper, wouldn't that also be very interesting, not only to IS folks and organization folks, but to the pharmaceutical industry, maybe even to the chemistry industry, maybe even to the broader field of medicine? I mean, they're looking at the AI topic, and here's a paper that looks at AI's impact on drug discovery, which is a key process. So my question is, number one, I don't think it's enough that a paper deals with this topic that has interest to this other audience. Because I don't think that any chemist, any pharmaceutical guy, they're not going to read MIS Quarterly, right? So would you agree, or do you think it'll just, because it shows up on Google Scholar, people will find it and read it? And if not, are you taking steps to sort of translate or, take your paper and go to these audience that are not in our field, but in these other fields, then, because it might be relevant to them?
We are definitely trying to do that. So a couple of things we're thinking about. We're thinking of translating into HBR article, hopefully, then, because a lot of executives will read them.
Yeah.
And secondly, I think it really comes from executives bring this to bench scientists. But I do believe that the top bench scientists, top AI people in the pharmaceutical should know this already. If they don't know it, I will be really scared for them.
Well, they suspect it, but it hasn't been validated, right?
Exactly. But what we do is, as a management scholar, we take the top 5% of industry and propagate it downward so everyone knows. That's kind of what I'm thinking of doing. I think if you bring this piece of results to AI people at top atomize other places, I think they wouldn't be surprised. They think, oh yeah, I think it makes sense, right? Yeah. But validating it, making sure it's right, and making sure other people who didn't know about it in the last 95% of the people, I think that's our main goal. So I think translating, yeah.
The way I look at, large scale regression based scholarship, when you say things like that, some folks already know it, is they may know it, but they have folk knowledge, right? They right. know idiographically, they know their context. They don't know to what degree this is a widespread.
That is true. And that's true. And we can quantify exactly what that
exactly
is.
I agree. Yeah. You make it sound like the idea isn't novel and all it does, it's validating a known idea. I don't see it this way. I think there's imminent practical value to someone providing very robust, substantial, quantified evidence about some stuff that some people may believe and others may not. Like papers like these, they settle arguments. You can take this and say, like, look, guys, I have evidence that it was going to work this way. So it's sort of like a showstopper. It's an elephant in a big executive decision room. So it's not just a validation of a known idea. It's sort of, I think that undersells it. That's why, I think just because it is such a piece of robust evidence, it will have interest to pharmaceutical executives, as you mentioned. So I do wonder whether the HBR tactic, it's an interesting tactic. I wonder whether that's the most effective tactic. There's got to be other ways to bring it into the pharmaceutical industries that's a little bit more direct than hoping that these guys also pick up HBR copies.
Well, CNN will pick it up. You have a public relations group that I'm sure will.
I don't know. Yeah, that's a good idea. But I feel there's a reason why we pick MISQ. We didn't go to JAMA or other places. So I do feel it's it doesn't speak to bench scientists as much. It really speaks to pharma executives.
Yeah, absolutely.
Where your AI should be, where your AI investment should be. So we feel strongly as a management journal, as organizational practice journal, and hopefully that is when the executive read these things and they will let their team know.
Now, the one thing that we all know that maybe AI people don't in the IS field, we've known for a long time that you need the technical folks and you need the line of business folks. You need both of them, right? You need both of those capabilities. Just the technical capabilities alone won't cut it. And I think what you've done is also shown that still applies to AI, right? You can't just come in AI and solve things. You still need the domain specialists as well, right? So I think that insight continues the IS tradition, right, of
right
socio-technical.
And I will argue is more so than traditional IT.
Oh, really?
Yeah.
So, but it's the same intuition, isn't it? Or do you think that the two are needed more in some way?
Yeah, I actually think that they need more because it's an iterative process. So IT, you create a tool and people use it and you're kind of done. But here, the AI algorithm are evolving. You're relearning from the data. Each time you operationalize, those things that feeds back into the improving the algorithm. So this is a continuous process, not just like, development, ship it off, you're done. This is iterative process. You finish, the user get the data back, and then feed it back to the AI algorithms.
Well, I think the next time we have you on, Lynn, let's start the discussion right there, right? Because I think we have a whole new one about what is different about AI and IT from a process standpoint. But yeah, I think there are differences, but it might not be that simple, right? So
yeah. And that's why you have a special issue to know these nuanced processes, right?
Yeah.
If it's the same as IT, then it's,
And to start the conversation, right? So and this is what I think the publication process is for, right? If someone disagrees with something you just said, right, they can do a study and argue with you, and that would be in the journals.
Yeah, and we hope other people will measure AI capability similar or differently and tell us, build on top of it. We may not be 100% right. They can figure it out, different content under different conditions. This works or will not work.
And I do think that work will hopefully inspire exactly that, what you just said, like whether it's a replication or a counter proposal or any of that sort. So there's certainly value there. Absolutely. Look, Lynn, thanks for coming on the show. That was really great having you and giving us a little bit of the backstory about the paper. We do hope that now people, even more people will pick up the paper, of course, now that they've listened to this. Congratulations again. It's absolutely, truly fantastic paper. We're really proud that we can publish it in a special issue, and thanks for coming.
Yeah, thank you. And I really have to thank the editorial team. I think it's definitely got a lot better after, the numerous rounds.
The numerous rounds in a year with a 1-year-old at home. All right. Well, guys, it was fun. Thank you.
Yeah, thank you.